colleagues. Thank you. I'm going to go ahead and turn it on over to my colleagues so that they can introduce themselves as well. So I will hand it on over to Lori. Go ahead, Lori.
Thank you, Derek. Welcome, everyone. We are so excited to have you here today. My name is Lauren Albandian. I use the she, her pronouns, and I serve as the admissions and recruitment manager here at the UC Berkeley School of Public Health. We are very excited to have you. One quick note that I would like to share with you all is that we will be recording this session. So if you would like to remain off camera, please feel free to do so. We also have a Q&A feature enabled for this Zoom session. So if you do have any questions, please feel free to include them in the Q&A section. Thank you for allowing me to get through a few of the housekeeping. I would like to continue on with our introductions, and I'm going to go ahead and pass it on to my colleague, Yesenia.
Hello, everyone. Buenas noches, buenas tardes. My name is Yesenia Mercado, she, her, ella pronouns, and I serve as the Student Funding and Admissions Manager here for the Berkeley School of Public Health. Lauren?
Hi, everyone. My name is Lauren Krupa. I use she, her pronouns. I'm the Director of Student Services for the School of Public Health. Great to see you. And we hope to earn your application today.
Thank you, Lauren. And so thank you everybody for your introduction. So, real quick, we'll go over and review the the agenda for the day or for the presentation before we begin. The agenda is pretty short. This presentation will be, just covering the introduction for you as a prospective applicant to the UC Berkeley School of Public Health, what the admissions process will look like, what you can expect from that, the cost of attendance and how you can help fund your education, and the various student resources and opportunities that are available for you as a student here at UC Berkeley Public Health. And once we're all done, we're going to wrap it up. Hopefully we'll have about 15-20 minutes available for Q&A for any questions that we didn't get to answer or weren't addressed within the presentation. Okay. And with this, I'm going to go ahead and turn it on over to Lori to give a brief introduction to the UC Berkeley School of Public Health and going and reviewing our missions, vision, and values, as well as kind of covering what careers that you can expect to have within public health. Go ahead, Lori.
Thank you, Derek. Yes, well, we are so excited to have you all here today, and we wanted to take a moment in our presentation to first kind of describe what public health is, right? What is public health? How does it work in our communities? What are some ways that you, as a working professional, can contribute to the world of public health? And first, it's understanding, well, what is public health, right? So, one of the biggest questions that we get is public health connected directly with medicine? Although medicine and public health do work hand in hand, public health is its own field, its own study, and the main differences are that medicine is individual focused. Usually, a patient will go in to see a physician or a medical professional seeking treatment, and that is the main concentration around medicine is to provide treatment. It is also around clinical sciences as the main focus versus public health focuses on social sciences a little bit more. In addition to social science being incorporated, such as psychology, sociology, into the curriculum of public health also looks at creating solutions on a population-based level. And it is looking at finding preventative measures. So public health takes what is called an upstream approach to finding solutions before they even become problems and having preventative healthcare available. This can include when you see an exit sign in a building for fire safety, a wear a seatbelt sign, no smoking signs. These are all public health initiatives. There's also a big emphasis around environment, human behavior, lifestyle, and overall access to medicine as well. Here at UC Berkeley, we stand on a foundation of our mission, vision, and values. Our mission here at the Berkeley School of Public Health is to improve population health, especially for the most vulnerable. We have a vision of health equity and social justice for all, and we stand on four core values, which is health is a right, there's strength through diversity, we are all about thinking forward, and we are also trying to understand what our impact is and making sure that we have a positive impact in the way that we work with communities and populations that we serve. Here are some of the careers that you can go into potentially as a public health professional. One thing that I always like to say is that public health is interdisciplinary. You can go into just about anything with a public health background because guess what? Public health shows up everywhere. So you can work in government agencies, you can work for nonprofits, hospital healthcare systems, university and research institutions, work within the private sector, such as insurance or consulting, international organizations, and of course, K-12 school and education institutes. Again, these are just some of the different careers that are available through a public health education and through a public health career. So, as mentioned, very interdisciplinary and a lot of room for growth, exploration, and of course, critical thinking. So let's take a look at UC Berkeley by the numbers, specifically the UC Berkeley School of Public Health. We are a population of about 800 total graduate students. This includes our master's and doctoral population. We have a 5-to-1 student to faculty ratio. So for every 5 students, we do have 1 faculty member, and which is great. We do prioritize having the connection and the ability to meet with faculty, get to know them, network, and really build a lasting partnership and a professional relationship so that when you are getting ready to apply for jobs and step into the careers of public health, you have wonderful references that you can speak to, get guidance from your faculty, and just get overall support throughout your time, not only as a student, but of course later on as an alumni and public health professional. Of our student population, about 47.5% of our students self-identify as first generation. About 15.5% of our students are international students, and about 28% of our students identify as underrepresented. Of our student population, about 72.3% of our students are female identifying, 24.4% are male identifying, and about 3% of our students are non-binary identifying. Of our student population, students are involved in many different degrees, and we at UC Berkeley Public Health offer a lot of different graduate options and degrees. So I really encourage you to take your time if you are interested in exploring the different programs that we have here to go through the different program pages, speak to us as an admissions team through an advising session, and just really get to know the programs that we offer here. Some of our programs that we offer here, and which are one of our most popular ones, is our 2-year Masters of Public Health program. Our 2 years of Masters of Public Health program comes in a variety of different concentrations, including epidemiology and biostatistics, environmental health, health and social behavior, infectious diseases, food, nutrition and population health, maternal child adolescent health, and health policy and management. We also offer 11-month Masters of Public Health programs. This is an accelerated program designed for individuals who already hold some level of professional degree already. So this may be another master's degree, an MD, a JD, a PharmD, and so on. One note that I do want to make is that our health policy and management 11-month program is currently paused for the fall 2026 admission cycle. Just wanted to point that out in case anybody happens to be interested in that particular program. And then in addition to our 2-year and our 11-month MPH, we also offer a 4+1 Masters of Public Health. And this program is specifically designed for individuals who are recipients of an undergraduate bachelor's degree from the Berkeley Public Health program. So if you are a current junior, senior, and you are majoring in the public health program and you may be interested in the 4+1 program, I encourage you to make sure to meet with your undergraduate program managers to make sure that you're on the right track to be eligible for this 4+1 program. And we offer the degree in epidemiology and biostatistics, food, nutrition, population health, and maternal child and adolescent health for that specific 4+1 master's program. In addition to our Masters of Public Health programs, we offer a number of doctoral degrees, including epidemiology, biostatistics, infectious diseases, environmental health sciences, and health policy, all of which are in a PhD format doctoral program. One note I do want to make is that our health policy PhD program is paused for the fall 2026 admission cycle. In addition to those five different academic PhD programs that are offered, we do offer one professional doctorate program, which is our Doctorate of Public Health program, or a DRPH program in the concentration of interdisciplinary studies. Additionally, we have a number of unique concurrent degree programs, and these are unique programs that we have partnerships with other professional schools within UC Berkeley. And these programs give you an opportunity to earn 2 master's degrees in 3 years. For example, if you happen to be interested in the Masters of Public Policy program and our Masters of Public Health program, you have an opportunity to do the concurrent MPH program, which allows you to do both the MPP and the MPH program in 3 years. Traditionally, a master's program takes 2 years. This gives you an opportunity to do the two programs in 3 years compared to doing them separately for 4 years total. We also have partnerships with the School of Journalism, City Planning, Social Welfare, and the School of Business. We also offer 4 Masters of Arts and Masters of Science degrees, 1 Masters of Arts in Biostatistics, and 3 Masters of Science in Epidemiology, Environmental Health, and Global Health and Environment. Last but not least, we offer a number of joint programs as well, one of which is our joint medical program, which gives you an opportunity to do an MS-MD program with UC Berkeley as well as UCSF, or University of California, San Francisco, which is just right across the bridge from us. And it's a total of a 5-year program. You would spend the first 2.5 years here at UC Berkeley and your last 2.5 years at UCSF completing the medical degree portion of your program. In addition to the MSMD program, we have a number of other programs which give you an opportunity to do a year residency with UCSF as well as completing an MPH here at UC Berkeley. So I know that that is a lot of programs and a lot of different concentrations. And a big question that may come up is, well, which concentration is going to be the right fit for me? And a very valid question at that. One thing that we encourage you to do is really take the time to understand the program to which you're interested in applying for. So if you are interested in, let's say, our Health and Social Behavior Masters of Public Health program, take the opportunity to explore that page, and there's a great resource available on our different concentration web pages that have a student handbook on the left-hand side, as you may see in the video graphic here on your screen. This will give you a full breakdown of the program, its goals, the faculty that are available, the classes you may take, and just giving you a great understanding of what the program has in store for future students like yourself. In addition to the student handbook, be sure to utilize our admissions requirement page to understand the program that you're applying for and the application materials that may be needed. Last but not least, take the time to talk to a current student. We have our very own Berkeley Public Health ambassadors that are here to support you. You can reach out to them through the sph@berkeley.edu email, which we will also have available these contact information at the end of the presentation. But that's a great way to connect with a current student and just hear from them and understand what it's like to go through the application process, in addition to what their experience is like currently in the program here at Berkeley Public Health. I'm going to go
Awesome.
ahead and turn things over to Derek.
Awesome. Thank you, Lori. So I'm going to go ahead and I'm going to be reviewing the admissions process and kind of a little bit of some of the little details that you as a prospective applicant should be aware of and make sure that you are that you're aware of and that you know before you start the whole application process. So for our residential admission requirements, we have our first requirement is a bachelor's degree. So all applicants must have a bachelor's degree or a recognized equivalent from an accredited institution. Um, as an applicant, you want to make sure that you have a satisfactory scholastic average, which is a very fancy and multisyllabic way of saying a B average GPA. Now, we are not looking at your cumulative GPA. We're actually looking at what we call your advanced GPA, which is the essentially, if you wanted to kind of boil it down to your last 2 years of attendance within your bachelor's degree and the GPA that you received in those last 2 years, then that's what we're really going to be looking at. What we do here at UC Berkeley School of Public Health in terms of review for applications is called holistic review. And so we're not just relegating you to a GPA. I know a lot of times many folks, many different programs across, not just here, but everywhere, put a heavy emphasis on GPA. We do look at your GPA very closely, but again, we're only looking at your last 2 years just because typically what we see and what we know is that folks in their bachelor's degree or in their undergrad have the most, I would say, not trouble, but the first 2 years are usually the roughest, and their GPA within those 2 years doesn't necessarily reflect the type of student that the student or the type of student that the applicant was or became. So we really, really look at the last 2 years or last half of your undergraduate degree, which typically and historically are the last 2 years have the highest GPA for most applicants. Most applicants, most people that complete a bachelor's degree have their highest GPA within the last 2 years. So that's what we're looking for. Okay. Um, in addition to that, we do look for, or I should say, the admissions committee does look for undergraduate training that's relative to your chosen area within the MPH or the public health concentrations. And so, depending on which concentration you're looking at applying to, you'll want to make sure that you check out the individual program requirements just to make sure that you are aware of each program's requirements because some programs have a little bit different requirements than others. So you want to make sure that you're aware of those before you start and submit your application. For international students, we do look for a passing score of the TOEFL. I should say, we look for a passing score within the TOEFL exam or the IELTS test score. And last but not least, we look for the submission of all other required application materials. Okay. Now, as far as the application materials, I like to just kind of always show just a checklist to applicants just to make sure, just kind of visualize and make sure that they are aware of all the materials that they need before they submit their application. Now, if you are applying to the to a residential in-person MPH program here at UC Berkeley School, excuse me, UC Berkeley School of Public Health, then you'll want to make sure that you take note that you will be applying most likely through the SOFAS application service. Okay, so for any applicants that are applying for for an MPH, a DRPH, an MS, or I should say the epidemiology MS, um, then that's where you will be applying through, which is the SOFAS application service. Okay. The good news is that once you've uploaded all your required application materials, including your resume, your statement of purpose, your personal history statement, transcripts from all college institutions that you've attended, as well as any required GRE test scores for some programs. The GRE is optional for most of our programs, as well as a writing sample. Again, optional for most programs. Then that's what you want to make sure that you have when you submit your application through the SOFAS application service. The good news is that even if you're applying, or I should say, even if you have to apply through the SOFAS application service, you still have to submit a UC Berkeley grad application. The good news is that once you submit your SOFAS application, you will be sent a link with information on how to set up your UC Berkeley grad app. From there, you just set up your UC Berkeley grad app profile and pay the application fee. So once you paid both application fees for both applications, then you're good. The good news is that once you submit all of your materials through SOFAS, be it your letter of recommendation, your transcripts, your writing samples, all of those application materials will automatically be copied and imported to your UC Berkeley grad application. Okay, so you only have to fill out one application, and that's through the SOFAS. Once you've completed that, submitted it, and paid your fee, then you will get the information to create your UC Berkeley grad app. All you have to do is pay that fee, and then all of your information from SOFAS will automatically be copied and imported to your UC Berkeley grad app. Okay. For applicants with a non-US and non-English Canadian bachelor's degree, you will also need to make sure that you submit a WES evaluation of international transcripts and make sure that's sent to SOFAS, as well as transcripts or degree certificates from each institution that you've attended, and the official TOEFL or IELTS test scores, if it's applicable. For TOEFL, the minimum test score that we're looking for is 90. For the IELTS minimum test score, that is 7. Okay. And here is a basic kind of general overview of the residential admissions timeline. So right now we are at October 9th of 2025. So our SOFAS application has been, or I should say the SOFAS application has been open for about almost 2 months, and our UC Berkeley grad application has been open for approximately 1 month. And so if you're looking at applying to start your program in fall of 2026, just know that the application is open. Um, if you are looking to apply, you want to make sure that you um, mark December 1st as the important date, the important deadline. That is the priority application deadline for all programs. Okay. And it's Monday, December 1st, 2025 at 8:59 p.m. Pacific time. So if you're on the West Coast, you have to make sure that your SOFAS application is submitted by 8:59 p.m. Pacific time, Monday, December 1st. If it's a minute late, then it is late. It is a late application. Okay. If you're on the East Coast, you have until 11:59 p.m. Eastern time, but majority of our applications come from the West Coast, so that is the time that you want to make sure that you submit your application. Now, we do have a handful of excuse me, we do have a handful of programs that have a secondary application deadline, which is March 2nd, and those programs are the interdisciplinary 11-month program, the food, nutrition, and population health programs, both the 11-month and the, oh, excuse me, both the 11-month and the 2-year MPH program. So those are the programs that have a second application deadline of March 2nd. Okay. We really encourage folks to apply for the priority application deadline just to make sure that you get it in as soon as possible, and that that you can be reviewed and considered for everything early on, as opposed to waiting for the second deadline. Okay. Now, once your application is submitted for the December 1st, we're going to say that, if you're an applicant that submitted their application for the priority deadline of December 1st, just know that we do not start reviewing applications until after the deadline has passed. So once December 1st has come and gone, then we will start collecting and reviewing applications. Typically, review of applications may start in December, but just know that December is usually the month where a lot of staff and faculty begin going out on vacation for the holiday and come back in January for the new year. So most likely the review of applications will be heavy underway after the holidays. So once we come back, or once the terms begin in January, that's when we collect all applications and begin review. And so that review happens and occurs for about 8 weeks or so, about 2 months, is when all applications are reviewed and decisions are made and sent out to all of our applicants. Usually about the end of February is when applicants can expect to get their admissions decisions for their program that they applied for. Okay, so and then after that, applicants will have up until April 15th to make a decision as to whether or not they plan to attend their program that they applied for. Okay. I know I mentioned the GRE score earlier, and I just wanted to let everybody know and reiterate that the GRE is optional for most of our programs. But a couple of our programs do require the GRE. So just make sure that you're checking to see if the concentration that you're applying for has a GRE requirement. But one question that we get oftentimes is, your program, or at least the program that an applicant applies for, has a an optional GRE test score option. And so one question that I get a lot is, if we applied for another program that requires a GRE, but your program or the program I applied to at your school is optional, should I still submit my GRE score? I would say yes. Especially if you scored well on your GRE score, I would say, if you had to take it for another program, then, if you scored well, then it definitely won't hurt you to share your GRE score if it's optional. Okay, so I just wanted to make sure everybody is aware of that. And so also, for your GRE score, what it does is it helps to kind of, show or, you know, I don't want to say it helps to show, but I would say that, um, what it can do or what can kind of reflect within your GRE test is experience in conducting research, evaluation, and quantitative analysis. If you're applying for a program that maybe that GRE is optional, then, kind of a counterbalance to the GRE test itself could be showing and demonstrating good grades in math or statistics, and also kind of highlighting any published papers or other evidence of strong writing. Also, any classes completed through the extension or community college classes can kind of supplement any GRE scores that are reported for your application. Okay. And I'm going to go. Oh, we still have one section before I turn it on over to Lori. So we have our letters of recommendation. So this is an important part of your application. I always tell folks, even though three is the minimum number of letters of recommendation that are required for our application, oftentimes I get asked, how many should I submit or what's the max I should submit? Which is funny because most times people want to just say like, how many do I need? So three is the minimum letters of recommendation that are required for your application. The maximum that we will take is five. So I always tell folks, split the difference. If three is the minimum and five is the maximum, then it's a good idea to, you don't have to, but I always, encourage folks to ask for people for your letter of recommendation, because let's just say if you ask the top three out of your four, you ask, and then one person misses the deadline or something happens and they can't, procure a letter of recommendation for you, then at least you have that backup as a third. So you're not missing the minimum three that are required. Okay. So I would always tell people, if you have three people that you know for a fact are going to write you a solid, positive, strong letter of recommendation, and you have no doubt about it, then three is fine. But let's just say if you wanted to just make sure that you are covered and your application doesn't get held up in any way, then ask four people for a letter of recommendation, and then that way you'll have the minimum three, and then you can include a fourth if you like. I always tell folks, if you are requesting a letter of recommendation, make sure to send your references, your resume, copies of your essays, information about your program that you're applying to, any interest points, potential research that you're interested in doing. Um, because that's going to help your reference write a much more full letter of recommendation. Another question I usually get is, is it acceptable to have TAs and professors co-write a letter of recommendation? Oftentimes, students will submit a letter of recommendation from a professor from a big class, and that big class might have 200 people in it, and so you have smaller sections, and so your TA probably has a much closer relationship with you as a student, and knows you a little bit more. So it's perfectly okay to have your TA and your professor co-write a letter. Okay, it's perfectly fine, just as long as it's is on a formal letterhead and submitted through a professional email, then that's fine. Okay. Also, it is a standard practice for you to waive your right to view your letters of recommendation as an applicant. I just wanted to make sure to highlight that. But one more little piece of advice is, if you are asking folks for a letter of recommendation, make sure to specifically ask them for a strong positive letter of recommendation. We have had some applicants in the past turn in letters of recommendation or have letters of recommendation submitted that were not very strong. And so just to kind of avoid that as an applicant, make sure that you are specifically asking for a strong positive letter of recommendation from your references before submitting your application. Okay. And last but not least, before I turn it on over to Lori, is make sure to include your resume. You want to make sure that you include all your educational degrees, any certifications, any employment that you have held in the past or currently, any experiences or skills. that you've attained over the course of time in those roles. You want to make sure to highlight and how those will be transferable and applied to the public health grad program and further career. Any volunteer activities that you've been a part of, any publications that you've produced or helped produce, any specific leadership roles that you've taken on. You'll want to include all of those in your resume to give your application review committee a much fuller picture of who you are and the skills that you've attained and that you'll bring into the area of public health. Okay. And I'm going to go ahead and turn it on over to Lori to kind of go more in depth on the writing samples of our personal history statement and the statement of purpose. Go ahead, Lori.
Thank you, Derek. Yes, this is something that we wanted to take some time to talk about. This is a big question that we get. What is the difference between the personal history statement and the statement of purpose? For those of you who may not be aware, we do require two different essay statements to be submitted as part of your application, one of which is the personal history statement. In the shortest term, the personal history statement is the opportunity for us to learn more about who you are, learn about your experiences, your values, your motivations, what has influenced your academic and professional journey and path. And through your words, we really just want to learn how your life experiences contribute to the person that you are today, right? All of us have lived a life, all of us have experienced different things, and all of those experiences have made us into the people that we are today. And we want to learn that about you. So some of the ways that you can do that is describing what ways you have academically and professionally prepared yourself to pursue graduate school. This can be a work experience, this can be a life experience, a community organization that you were a part of, just a life experience that you had potentially volunteering for an organization in your community. A lot of different experiences, a lot of different motivations can lead you to why you are choosing to prepare to pursue a graduate school and how you prepare to do so. The next thing you could do is definitely be sure to connect your personal history to your future aspirations post degree, post Masters of Public Health, postdoctorate degree, because this is one phase in your life. We are part of a journey in your life where you are learning, you are growing, but once you graduate and you leave the UC Berkeley School of Public Health and become an alumni, you are stepping into the world with a whole new perspective, a whole new degree added to your name, and you want to be sure to showcase to us how your personal experience and personal history is connecting to that future version of yourself. And of course, last but not least, share who you are. We want to learn who you are. We are going to learn about your transcripts. We're going to learn about you through your resume. We're going to learn through your letters of recommendation. This just gives you a different opportunity for you to really take the time to express to us who you are. On the other side is your statement of purpose. Your statement of purpose is the why. Why are you applying to UC Berkeley School of Public Health? And why do you believe now is the right time for you to pursue this degree? And there can be a lot of different motivations around why you believe right now is the right time for you to do so. So maybe it's a particular public health challenge that the world is facing that inspires you and you're passionate about it, and you want to find the tools here through our School of Public Health to address it. You can describe how the UC Berkeley School of Public Health programs, in maybe the specific concentration that you're interested in, is inspiring you to pursue this degree. It could be our resources, the faculty that we have, the research that's being conducted here, all the different knowledge that we may have that you not only want to contribute to through your own experiences, but also that you want to learn from and make a positive impact in the communities that you serve. And of course, we want to understand how you align with the program, and in turn, how the program aligns with who you are as well. So this is, again, why we reemphasize the importance of taking the time to understand the program to which that you're applying for, so that you can also be well prepared to write this statement of purpose. Another component of your application, which is optional for most but required by some, is a writing sample. The programs that do require a writing sample is our environmental health sciences, global health and environment, health and social behavior, interdisciplinary, and doctorate of public health programs. A writing sample could be a final paper from a class, a final thesis, a popular media article that you may have been the primary author on, publications that you were the sole or the first author on, papers written in another graduate program that you may have been part of, or reports written for a public agency. I am going to go ahead and turn things over to my colleague, Yesenia.
Thank you, Lori. Here is a breakdown of how much our residential tuition costs are for the full length of the program. So for students who are California residents and are seeking an 11-month MPH program, the current cost of tuition is 38,856.50 for the full entirety of the program. Students who are non-residents for the 11th-month program would be paying around 51,101.50 for that duration. For the 2-year students who are looking at completing an MPH, you're looking at 66,311 for California residents. Again, this is for both years, and 90,801 for non-residents. 2 years master's degrees in arts or science, looking at 45,247 and 75,451 for non-residents. These are estimates based on the current cost. However, we do understand that these are subject to change from year to year. For non-resident students, we encourage them to pursue or complete the California residency tuition and establish California residency during their 2nd year. So it is a residency reclass that students can complete so that in the 2nd year of their program, they are no longer charged the NRST or non-resident student tuition as part of their overall cost. So how do we go about funding our education? Before we get to that, this is also an example of what the tuition breakdown looks like for the current year. So we have academic programs, which include, again, master's and PhD programs, the total cost of tuition, all the different campus fees, insurance fees, as well, and then also the new master's or new doctoral totals. So for the insurance fees, there is a way for students to waive the health insurance fee if they have equivalent levels of insurance through another source. You can request that fee to be removed from your overall cost of tuition as long as you submit the waiver before the deadline. Tapping into the new master's total and new doctoral total, you will see that there's an additional fee just for that first year that you'll be starting your program. In the 2nd year, you will no longer be charged that new total, the new master's or new doctoral total. For the professional degrees, MPH or DRPH, we have the same breakdown as far as the tuition and campus fees, as well as the professional degree supplemental tuition known as PDST for each residents and non-residents. There is also the health insurance fee, which is also something that you can waive just like academic programs. And also, like I mentioned, the MPH new student total and the DRPH new student fee as well. So how do we go about funding our education so that we don't have to worry about that while we're finishing our degrees? First and foremost, I encourage all students to complete the FAFSA or the DREAM Act applications so that you can have your student loans, federal student loans, set up for when you start. This doesn't necessarily mean that you have to take out student loans, but it's always nice to have that ready should you need to tap into that at any point in time during the duration of your program. FAFSAs and DREAM Act applications have to be completed from year to year with an encouraged deadline of March 2nd every year. So I always encourage students to just get it done in the spring semester for the following year. That way, once you start in the fall, it's one less thing you have to worry about completing. In addition to the general questions that Lori and Derek broke down during our time today, there's also specific funding questions that lead to need-based and merit-based fellowships directly from the Berkeley Public Health School. I always encourage students to take their time in answering those funding questions, as it'll directly affect your eligibility for our fellowships from our campus. In addition, students can also receive training grants that can help pay for their tuition and also provide stipends. And of course, we have on-campus employment like graduate student researchers, readers, TAs, and work study through the federal program that offer fee remission. Fee remission is a funding support that'll waive or that'll pay all of your tuition expense for that semester. Therefore, all you would have to pay is your pretty much that professional degree supplement tuition, PDST, if you'll be completing a professional degree. So normally, GSRs or GSI positions are sent out towards the beginning of the semester and they are competitive. So definitely tap in with your program so that makes sure that you are aware of these opportunities. And then that way you can not only receive additional funding to pay for your tuition, but also gain networking experience with the professors that you'll be working with. There's also off-campus jobs and internships. Berkeley Public Health is located in downtown Berkeley, so there are opportunities that you can seek employments near our campus, as well as external funding like private loans.
Wonderful. Thank you, Yesenia, for providing that great breakdown of funding education, tuition, and everything related to that area. I'm going to take a few moments to just kind of talk about what makes Berkeley Public Health so special. What are the resources that we offer for students? These are not only going to be Berkeley Public Health specific resources, but also just general UC Berkeley campus-wide graduate student resources. So let's dive right in. These are our general UC Berkeley graduate student resources that are available to you as a student. Some of them include resources for parents, which provides emergency childcare, parent and caregiver grants, as just support as you go through this process. We understand that being a student is only one component of your life. There are individuals who are parents, caregivers. You may be changing degrees, coming back into your education after some time maybe working in an industry or a particular career. So these are all resources that are available to you to help you navigate your time here as a Berkeley Public Health student. The next is the Student Technology Equity Program, or STEP. This helps with technology hardware such as laptops, iPads, just helping you navigate your time here as a Berkeley student. We also offer DLab, or the UC Berkeley campus also offers DLab, which helps with research development, design, and data acquisition. The Graduate Wellness Center. This is a graduate-focused wellness and mental health services that are located separately from the undergraduate services. So this is services specifically for graduate students. There's also the Basic Needs Center, which offers a food pantry. They will also help with applying for CalFresh or EBT. They offer emergency housing loans as well as specific resources for international students navigating their time here as a student. Last but not least, you also get the Bay Area Transit Easy Pass, which gives you free transportation for our local bus routes, as well as the train system for the Greater Bay Area, which is known as BART, Bay Area Rapid Transit, all free of charge. Included in your time here at UC Berkeley School of Public Health, you will have access to our Dream Office. This is a resource specifically here at the School of Public Health, and the Dream Office offers services for you as prospective students, including our Berkeley Public Health ambassadors, advising and mentoring services through our different team members there. And then as a current student, you will have access to our very own Dream Office food pantry, specific for School of Public Health graduate students. We also have a community space that serves coffee and tea and snacks. And then in addition to the tutoring services that will be available in your individual classes, you will also have epidemiology and biostatistics tutoring services as an additional support throughout your time here. Another great resource for you all is our RISE office, which is our Berkeley Public Health Career and Leadership Office. As Masters of Public Health students, for those of you who may be interested in that particular program, you are required to complete what is called a practicum. A practicum is essentially a graduate level internship that is required for you to complete a certain number of hours as part of your requirements to earn your Master's of Public Health degree. And our RISE team is one of the offices and support services that are available to you to help you find your practicum, prepare for finding your practicum. They also just offer general advice for preparing your resume, preparing you with interviewing skills. They provide free professional headshots, for example, for your LinkedIn profile, and just overall leadership development resources as a RISE office. And the RISE office is not only available to you as a current student, but it will also be available to you as a lifelong alumni. So even if you graduated 10 years after your program, you will still have access to the RISE office to provide you services as a Berkeley Public Health alumni and get you connected with our 90,000 plus alumni that are around the world. So here are some ways for you to get involved on campus. And these are some of the student groups that are available specifically here at the School of Public Health, including our Alianza Latina for Public Health Action, Asian Pacific Islander Women's Circle, Queering Public Health, Black Advocates for Equity in Health, and Student Collaborative for Impact Leadership. We also have our very own UC Berkeley Public Health Student Government, which has student representatives from both our undergraduate and graduate programs. And within that student government are different committees that you can potentially serve on, including our education policy and diversity, equity, and inclusion committee. And one fun fact about Berkeley Public Health is that we host a Berkeley Public Health prom every year. Yes, you did hear that correctly. It is a prom. It is a fun way for students to dress up, eat some great food, and it is an off-site location so that you really get an opportunity to disconnect from academics and have fun with your friends. One other committee that you can potentially be a part of is our Wellness and Sustainability Committee, and we do have our very own garden here on our terrace at the School of Public Health, so you can be part of our gardening services and support with that community garden that we have and volunteer. Every year on Earth Day, we try to do something to go out there and maintain that beautiful garden that we have, and it's just a fun way to, again, be involved as a student here at the Berkeley School of Public Health. So you may be wondering, okay, Lori, Derek, you went through all this process of how to apply, how to fund my education, how to go through this whole experience. Where do students end up going? What do they do? Well, here are just some of the places that our students end up going after leaving and becoming alumni of our School of Public Health. And these include Stanford School of Medicine, Berkeley Free Clinic, California Department of Public Health, Sutter Health, UCSF Medical. Some continue on their education at potentially the Keck School of Medicine, again, UCSF, Kaiser Permanente. As you can see, many different locations and lots of variety. So we mentioned in the beginning, for a public health degree is interdisciplinary, and you can truly see it reflected here.
All
Well, I'm
right.
going to turn things over to Derek to wrap it up for us today.
Thank you, Lori. So that pretty much does it for our presentation on our residential Masters of Public Health programs that we offered here at UC Berkeley School of Public Health. I want to thank you all for taking the time to join us and learn more about the application process, learn more about our admissions requirements, as well as the resources that are available to you as a prospective and potential student of the UC Berkeley School of Public Health. I wanted to make sure to include our contact information for anyone wanting to follow us or to reach out and contact us. So for if you're looking, if you're on social media, which I hear is a pretty big thing nowadays, you can reach out to us and follow us at Berkeley Public Health. That is our handle at Berkeley Public Health, and that is the same handle for our Instagram account, our LinkedIn account, as well as our Facebook. If anyone is on Blue Sky, you can follow us at Berkeley Public HLTH.bsky.social. And typically I would say social media is more kind of like passive. You're just kind of following what's going on and important dates and events and whatnot. But if you have any specific questions about the application process or any of the requirements or anything like that, you can always reach out to our admissions office at sph@berkeley.edu. Any questions regarding funding, you can always reach out to sphaward@berkeley.edu. Okay. And if you want to reach out to our dream office and get connected with any of our current students that might be able to give a little bit more insight about the program or your program of interest or what the application process was like or any pointers for anything regarding your application, then you can always reach out to sphdiversity@berkeley.edu and we will definitely make sure you get connected with a student there. And with that, I will say thank you. Thank you to everybody for taking the time to join us this evening. Now we're going to open it up for Q&As. I know that we've had, excuse me, some questions coming into the Q&A section of Zoom that myself and our staff have been answering since, or I should say throughout the presentation. But if anyone has any questions that they would like to propose, you know, live over the mic or in the chat, you can still have the opportunity to do so. And I'm taking a look at the chat. It's pretty good. All of our questions in the Q&A section seem to be answered. Okay, so it looks like everybody is kind of on top of it. Um, does
So
anyone have any questions, or does anyone want to add anything
yeah,
to it?
we'll give you all a few minutes to include your questions in the chat, and then I'm actually going to go ahead and stop the recording so that you all can feel free to ask any questions that you would like. So just one moment.